My name is Mark Emberton. I'm a urologist specialising in the management of prostate cancer. Today I'll be explaining a little bit more about HIFU, or high intensity focused ultrasound, what it is and what it means for patients and how we use it in the management of early prostate cancer. HIFU is a non-invasive treatment for the prostate. It uses sound energy. The easiest way to think about it is to imagine somebody playing with a magnifying glass and the sun's rays, and then using the magnifying glass to focus the sun's rays into a spot. And if that bright spot is put on your skin or on a piece of paper, it will burn. Interestingly, if you pass a finger between the bright spot and the magnifying glass, you feel nothing. HIFU does exactly the same, but with sound waves. So it concentrates the energy into a tiny area, which results in the tissue being ablated. Ablated is just another word for being destroyed, with a combination of what we call kinetic energy, movement, and heat. And so essentially we're spot welding the cancer and the small area around it, which we call a margin. And we do that by placing a probe in the back passage, in the rectum. So in other words, there's no needles, no cuts, and then ultrasound is transmitted across the rectum into the prostate. That process takes about an hour and a half to complete. Patients come in the morning, go home in the afternoon. They have a catheter in over the weekend, typically, because the prostate swells a bit, and they come back on Monday and it's removed. HIFU is one way in which we do focal therapy. Focal therapy aims to treat just the cancer and preserve as much prostate as we can. If you preserve prostate, you preserve function. So men having HIFU, if they have good erections prior to treatment, have a 95% chance of keeping their erections. Continence, which is a big issue after surgery, can be an issue after radiotherapy, is largely preserved. We tell people they have about a 1% chance of experiencing some leakage after HIFU or focal therapy in general, and that's because we're not treating the sphincter or the urethra of the prostate. So people ask about HIFU because they want to preserve their sexual function and they want to be continent, and they also want a very quick recovery, as I said earlier, in and out in a day, but can be back in the office the following week or the week after, albeit on light duties for the first week. The patients that benefit most from HIFU are people that have focal disease. In other words, one area of cancer within their prostate that we can get at is within range and around which we can place a margin. We have 2 decades of experience in doing the treatment. It's more than just the HIFU machine. Success requires a very experienced operator, but actually more importantly is the team that the operator works with. So excellent histopathology, world-class radiology, because the treatment is defined by the MRI, so working in conjunction with real expert radiologists is the secret to success.